welcome back to my channel. Today I'm going to start one of the most important topics from the good practice, which is privacy and confidentiality. But before we move on, I just want to highlight and let everyone knows that if you don't know how to go to the good practice, there is a very easy way. Just write the Google Cmpa and then you come on this bar somewhere and you put the education and events and you go down to the good practice and it will come up to this page. I have already done professionalism, boundaries, and cultural safety in my previous videos in different parts. You can watch that and let me know if you need any more explanation regarding that. Without wasting any time, let's get started. So, for privacy and confidentiality, this word indicate what we are talking about and why we are talking about. Because every information is confidential, we have to keep it private. We can only share with the people the people should know about it. It's not everyone, but the only who are in the circle of care for that patient. So protecting your patient's personal health information is very important. We don't just talk about personal informations like phone number, address, name, date of birth. We also talk about their health informations. Any kind of health information is also considered to be having confidentiality. So introduction: patient shares sensitive, often intimate informations with their doctor. Physicians have legal, ethical, and professional duty to protect patients' confidentiality and privacy. We always have the legal duty, ethical duty, but more importantly, it's our profession which allow us to practice professionalism, and professionally we have a duty to protect that. The legal duty to keep a patient's personal health information confidential originates from the trust relationship between a doctor and patients. Privacy legislations reinforce this duty and require an individual's consent before their personal health information can be accessed, collected, used, or disclosed, subject to specific legal exceptions. Why we are talking about here exceptions? Because when you say to your patient, okay, I'm going to make sure that everything we talk here is going to be confidential unless it is required by the law, because in some situation even patient doesn't give you consent, you have to reveal that information. Let's suppose if someone is epileptic, they are not well treated yet, so you have to tell to the driving authorities that this patient cannot drive. The reason is you patient doesn't like it, but it's your duty to do that. That's why whenever you take your sentence, just make sure you say unless it is required by the law. So it's not about sharing it, it could be about using it somewhere. Let's suppose research purposes. If you are using it, you need to make sure that the patient is giving you consent. Every time you do it, you need consent, except in few situations. The duty of privacy and confidentiality applies to every healthcare provider and staff who has the access to medical record. Everybody who is working with the patient. It could be healthcare staff, it could be health care aid, it could be nursing staff, anybody who can see and do something for the patient's personal health information. Trust in the confidentiality of an encounter and the protection of information recorded as a result encourages the patient to provide their doctor with the relevant information. This is the trust which, okay, if a patient come to my office and I say, okay, we have a very good relationship, they trust me, because they are not going to have any hesitancy to share their any kind of information, especially STBBI history, which is very important. Substance use history, which people doesn't tell the doctors because they don't have that trust building relationship. So if you are protecting their confidentiality, they will trust it, and then they might be encouraged to share more information, which is very relevant, and sometimes it's very important for the management perspective, enabling the physician to determine the diagnosis and treatment and reducing the possibility of harm for the patients. Let's suppose patient comes to you and patient says, doctor, I'm having some alcohol addictions, I just need to cut down that, and you try to give the naltrexone because patient did not give you the enough information about the opioids. And if you give them naltrexone, and that can lead to opioid withdrawal symptoms, and then it will make the condition worse. So you are basically not treating one thing, you are actually harming something. And why you are harming it? Because the patient did not tell you, because he doesn't have that trustworthy worthy relationship with you at this point. So that's why telling the patients again and again, it's a non-judgmental room. Whatever we talk, it's going to be private, and confidentiality will be maintained unless required by the law. So they will open up to you. So that could be one of the example I'm just sharing to see why we can be harmful. Like, doctors doesn't have the intention to harm, but if they're hiding it, if they're not sharing it, probably at some point of time it would be harmful for them. Sharing information, we do share information, and it's very common a practice. It's good to do it, because if we don't do it, all the multidisciplinary team, all the health allied teams cannot work together. So that we call the circle of care. But there is a boundary of their circle of care that is always locked. Is the group of healthcare provider treating a patients who shared information to provide that care. It's a very simple story. If you are working in an internal medicine department, you will know the patient is admitted, which is 68 years old, female, come with a complex medical history and other stuff. So who is going to take care of that patient? First of all, the doctors, the consultants who are working there, the internists who are working there. Secondly, the family doctor, because you are going to share everything to the family doctor once patient get discharged. Social worker, because patient might need some kind of social support. The nurses who are taking care of that patient. Psychologist, because might be patient is going through some kind of socio-economic issues and other stuff. You are involving the clinical psychologist in your wherever you are working. Maybe patient need physiotherapy, because patient needs help with their mobility, and massage therapist. Anybody who comes in that circle of care, everybody can talk about that patients very freely, and this information will be shared between all these groups of people. The concept of circle of care allows the sharing the patient's health information between the healthcare provider who are providing care to their patients without seeking the patient's express consent every time information needs to be exchanged. This allows the provision of clinical information to colleagues when consulted. So we don't ask them. We say, okay, we are going to consult you for some specialist, but we don't ask them, are you okay with it? Until unless it is something like addiction medicines, we ask them, are you okay if we consult them? Are you interested in that? But for other medical reasons, if that is not our specialty, we always ask nephrologist, neurologist, urologist, gynecologist. We always ask them, they come and see. Implied consent. But for addiction medicine, sometimes patients are not open to quit something, and they don't want addiction medicine to be involved. So that's the one thing. Implied concern to share information with provider and the circle of care is generally implied. You don't have to take a consent. It's obvious. A patient or the substitute decision maker who accepts a referral to another healthcare provider implies concern for sharing relevant information. This includes sharing with the physicians and other healthcare provider like chiropractor, physiotherapist, psychologist who are caring for that patient, and but does not include other such as family members, friends, police, and so on. So here what it's come as implied concerns is only who could be the participant of the circle of care. But here family members, police doesn't come into the circle of care. Family member you can only provide if the patient wanted to be provided. Express concern, when we have to ask the patient. Express concern is required to share the information with the people outside the circle of care. If there is any possibility of doubt about whether or not physician has the patient's concern to share information, then seeking express concern is wise. Express concern is you just ask them, do you give me permission to do that? It doesn't mean that always written, but if they say yes, you can document it. Although verbal consent may be acceptable in many circumstances, frequently there is a need for written consent confirmations. Sometimes talking about a central line, talking about some kind of minor procedures, talking about something where they need the written consent to make sure that we are documenting things, that's very important. But most of the time verbal consent is still acceptable. Depends for which reason you are taking consent. Consent may be confirmed and validated by means of a suitable contemporaneous notations or by the treating physicians in the patient's record. Sometimes if you want to confirm and validate it, you can do it in the patient's record. Patient has given the consent for XYZ reason. Patient is Patient was aware about the risk and the benefits of this thing. Patient was address all the questions, and we have given the alternative information to the patient. So everything should be given in a way that you say, okay, patient is concern is confirmed. It's not just we say, oh, this is the paper, you just sign it. We don't tell anything. We do tell everything. That's the express concern. Sharing information with the family, it's very common and very obvious. We do it when patients know that their family members are involved in most of the things. But on the from the ethical perspective, we need to know patients wants to tell it or patient doesn't want to tell it. Sometimes, like uh, a male person who is in the hospital, there is a STBBI positive and the wife is there. Even though wife can take all the decision, but maybe male person patient doesn't want to tell this STBBI results positive to their wife because it will ruin the relationship, right? So we have to take care of that part, especially the sensitive things. Other than patient substitute decision maker, family members are not within the circle of care and are not entitled to information about the patient's care without the express consent of the patient. And here, usually, I would say the written consent is the best thing, but it, it could be verbal too. Generally, if the patient is deemed capable of providing informed consent for the treatment, the patient should also be able to authorize the release of their confidential health information. If the patient is capable, you can ask it, is that okay if I give the information to your family members who are asking me this question? Or do you want me to provide some of your confidential information to your family members? They have to authorize it, they have to give you consent. Typically, minors who are capable of consenting to the treatment will also have the capacity to control their personal health information. This is a very uncleared answer sometimes what we talk about minors. So other than Quebec, all the provinces doesn't have any age for the minors. You can ask the minor for some of the information, but you have to think how much they are capable and how much they can understand the things which you are asking for. Let's suppose if you're asking someone about their brain surgery, maybe they don't understand it, because if they are if they are minor, they are 12 years old, they don't know the risk and benefits and everything. But if you ask them, okay, there's a wound, I want to suture it, and if they say yes, yeah, you can do it. So it depends on that it doesn't depends on the age, but it does depends on the competency of the patient, which is minor, and secondly, what kind of thing you're trying to ask them. These minors should understand what information will be released and to whom, and should be capable of understanding the consequences of disclosing or refusing to disclose their personal health information. The same thing comes here with the privacy and confidentiality. If a patient is 15 years old or 13 years old, she is sexually active, she missed her period, maybe her pregnancy test is positive, she doesn't want to tell their parents about their pregnancy or sexual activity, that's still okay. As far as the partner is not the higher authority on that, and you are not getting a red flag of any kind of sexual assault or anything, they are 13, they're sexually active, that's okay not to disclose. But you have to tell them, okay, you don't want to continue this pregnancy, you want a medical or surgical abortion, that's still applicable. But during and after the abortion, you might need some support, and it would be good that your family members are around there. So we have to tell them that if you refuse it, it would be difficult for you, but it's their choice. Note, the concept of mature minor is not applicable in Quebec, where laws specifically defines the age of the concern, which is 14, and the circumstances in which a minor or their parents can consent to the release of their minor medical record. All the provinces talk about mature minor, means the minor who is mature enough to give their consent. Generally, physicians are permitted to disclose personal health information where the disclosure is required to contact a relative, friends, or potential SDM if the patient is injured, incapacitated, or ill, or unable to give consent personally. We usually do that, especially when you will see in the geriatric population or complex medical history, or the patients who are having high diagnosis or high medical condition, the chances of going into incapacitate is very common. uh, then we ask them when they come to the hospital, and when we know that they can give us answer that okay, my son is there, my brother is there, my partner is there, my sister is there, my mother is there, do you want someone to be taking the decisions when you are not able to do it? So that's the one thing. I'm going to read all of this topic in my next video. Thank you so much for watching my video. I hope you like it, and if you have any specific topics you want me to read from the Cmpa website, do let me know, and check out my all the other videos. Some of them would be very beneficial to you, I'm pretty sure about it. Thank you so much and have a great day.